Hi, Dr. Patterson here. And in this video, I'm going to talk about the goals that I have for you, the patients, for 2024. Already in 2 days, the census is really up in hospitals with patients entering through the emergency room with heart attacks and stroke. And so we've just come off of 2 weeks of major eating and drinking. It starts all the way back in October with Halloween being the first, and it's postulated that Americans gain anywhere between 10 to 13 pounds during that period of time. Uh, that's really just 2 months, so that's a lot of weight to gain. But then you also put yourself at risk of just what they're going into hospitals. Hospitals in this area don't have enough beds, and so patients are on gurneys in the hallways. So, and this is from overeating, I'm saying eating too much of the wrong foods um, at the wrong time. And so it's really at a time where you should be really conserving um, your intake of food. Now, just like with bears hibernate during the winter months because they store up enough food during the fall and the spring and summer to go through. That's their fasting. So they fast through the winter months because of the storage of food. So now you should be doing the same thing. But my goal for 2024. So what I do is, like all patients do, they go through their files, they check the charts of the patients who they've seen for the year, and see how they can better serve them and help them achieve better health in the coming year. So this year, the goal is to get you off of meat and dairy. There's so many. You have to go to the YouTube posts to get all of the details on it. There are a lot of problems associated with dairy. And I mean, these are things that you can take care of yourself. The consumption of dairy, the consumption of meat. And you really should not, you're not designed to consume either one. You're 70% water and 30% solids. And so your diet should be 70% water and 30% solids. And so normally what we see is about 90% solids and about 10% water. And that water is in the form of tea, coffee, and beverages, and not so much H2O. Okay, so that's my goal. I had a question for you, and maybe you all can, maybe you know, maybe you don't know, but you know how to research this. Does anybody know where you can get Ethiopian butter? Ethiopian butter is fermented butter. And so it goes to show you, if you go back to your ancestry and look at your diet, you ate a lot of fermented foods. Anybody who lived between the equator, if you're more equatorial, between 0 degrees and 37 degrees north latitude, 37 degrees south latitude, it's certain foods that we ate that we don't eat here or can't get. So let me know about that. The Ethiopian butter is fermented butter. That's good for your colon, helps prevent leaky gut syndrome. It balances out the normal flora. You don't have to take the capsules. You don't have to take pills for probiotics. And so any type of fermented food is excellent for your colon. And that's good for people with autoimmune disease. See, so let me know about that. I put the patients on ghee butter. That's more in line with the people that come from India or Pakistan, that area. That's what they use. It's a little bit better than some of the butter that we have here, but the Ethiopian butter is better. If you're a Black person living in this country, you need to eat foods that you once ate when you were before this bad incident that we experienced. Okay, so the other thing is, we talked about goals, talked about the butter. You need to increase your vitamin D3, K2 during the winter months, during this period of time, because it's low. We don't have enough sunlight. And so our immune system, actually, it begins to diminish in its ability to protect us. So you want to make sure you get that up. That's important. Make sure you order. I talked about the fasting directive. You may not be able to fast right now. It's a mental process. People like myself and some of our patients have a lot of experience in doing it. It's supervised by me, or you need to get a medical professional, preferably a chiropractor or a naturopath who's used to doing this, who knows how to administer that process with you. So it should be done under supervision. Either way, most of you are not ready for it. It's a mental process, but you can get the fasting directive. It's a book I put together, like I said, maybe like about, I think it was 2014 or 2011. Either way, right now, there's so much talk about it now that it actually promotes my book. So, you can go to the link and order that through us. We are sending it out, taking phone orders for it until we put it on that Shopify. So get that. You might change your mind in the next 10 to 12 months. See, so that's why I say it may just take some reading to kind of get you to get a better understanding as to what that's about. The other thing is the 10-day health information response program. Now I'm going to put that on YouTube also, the explanation for that. So you're not ready to fast. And what you want to do, you need to do something. You have to do something post holidays in order to reduce that 10 to 13 pounds that you may have gained. That is dangerous weight to gain that kind of weight in 2 months, in 8 weeks. See, so that means that your elimination and detoxification system is not working. This program here is a 10-day program. I use that for a lot of our sisters who are grossly overweight and they need knee replacement. And so the orthopedic surgeon won't do the procedure because they're too heavy. So they need to lose weight. And they may have to do this 10-day program maybe 3, 4, 5, or 6 times in order to lose the amount of weight to get the procedure done. What we find out is that they stated to us that their knees no longer bother them, but some still have it done. But it's showing you that weight is a huge factor. I have another question. Before I get to, I'm going to leave on that note. But I just wanted to mention tomorrow's our phone conference. For those patients who join us on the phone conference, we talk about a variety of health problems. I will be finishing up Cancer Part 2. It's at 6 p.m. And make sure that you can contact Vicki to get the information as to the, the number to phone in with. But I want to leave you with this here. Let me ask you something. And these are, you're not having problems, obviously, if you listen to this, watching this broadcast. But would a heart attack or a stroke change your life? I mean, would it impact your life in some kind of way? I mean, you're healthy right now, or seemingly healthy, but if you had a heart attack and survived, or if you had a stroke and survived, would that impact your life? I mean, the things that you do, your activities of daily living, your income, your ability to work, your ability to socialize, travel, just the things that you are doing right now, would it change that? And the reason why I'm asking you that question, because I want you to really give that some serious thought. We're just 2 days into the new year, and already people are having heart attacks and strokes. I can't say that it's in record numbers, but anytime you go to the hospital emergency room, you are given the information that you need to be seen or further testing. So they want to keep you. That means that something is truly wrong. They've got to make sure they get to the right diagnosis based on your symptoms and then offer some form of therapy. So it's going to take more than just a visit. So that's going to impact your life right there. I just want to know, would it make a difference with your life if you had something occur like that? Okay, so what I'll do is until next time, we're going to focus on this phone conference. You focus on, I want to know about the Ethiopian butter. And you focus on those 2 situations that we just mentioned. Okay, best in health.